All right, I think we're good. I hope the audio is good on our lives as well. I know in the Zoom meeting, Robert, do you want to give me a thumbs up? Are we good in the Zoom? Can you hear me? All right, okay. All right, welcome to our special needs planning workshop. Let's go ahead and kick this off by way of introduction for those of us who are new or joining for the first time. My name is Tanner Withers. I am the host of this special needs planning workshop. I am also the founder of All Ability Planning, which is kind of the engine and the brains behind all of this. But first and foremost, above all else, I'm a parent of a child with special needs, just like many of us who are joining this call. And that's ultimately why I do this, is I want to help as many parents just like myself figure out how to do whatever it is, life with a child with special needs. So specifically, we like to talk through topics on financial investments, benefits, estate organization, and family support. There's a lot of groups out there that do a lot of other things as it relates to special needs support, and we found a really good opportunity to help with this particular piece. Here's kind of the format, purpose, and everything of what you can expect. The purpose of this workshop that we do every other week is to empower families of all abilities to live their life's potential. Again, our contribution to that comes in the form of planning, and specifically those topics that I mentioned. We want to be able to make it so that parents can really have to not worry about all of the things that may happen or will happen at some point in the future, and instead live and enjoy today by having a plan in place. The goal of this workshop and every workshop that we do hereafter is to give you, as the parent or guardian or caregiver or whatever role you fill, the information you need to confidently take the next step in your family's special needs planning. And so we're going to invite you to take action here at the end of the workshop as well. And the format looks like this. We've we've adjusted it for summer hours. We'll probably readjust it when we go back to school in the fall. So our summer hours look like this. This is going to be bi-weekly on the second and fourth Tuesday afternoon at 1 o'clock Mountain Time. I am in the great state of Utah, which is in fact and undisputable the best overall state in the country. You can Google it. Second year in a row. We're very proud of that. So that's why it's Mountain Time. Again, we'll adjust this and we welcome any feedback on times that may be better. We'd like to make this quick and bite-sized so that you can learn what you need to learn and get on with your day, but also make it actionable and implement it. So we'll do about 15 to 20 minutes worth of content and educational content. And then we'll go through about 10 to, well, as much Q&A as we possibly can. I know that a lot of you are joining us on our live streams. I have not figured out a way yet to answer questions or field questions and answer on those live streams.
And that does make it more valuable because it's tailored.
The live stream, or excuse me, if you're in the Zoom, we'll be able to take questions. If you're not, if you're on the live streams, not sure how to do that yet. So, but you can also ask any questions in our Facebook group, which is where this will be recorded. We have a table of contents that outlines every workshop we've done thus far. So that's where you can find it. Important disclosure before we kick it off so that I don't get in trouble and we can keep doing this. This is education only. I'm a professional. I do this for a living. I give advice. I'm not giving advice right now since we are being broadcast all over the internet and recording this. So please don't take this as advice. If you are looking for advice, great. Please reach out. I'm happy to connect you with the best person to help with that advice. But today is education only. All right, so let's jump into our topic for today. This is a little mini series that we started probably last month called the transition to adulthood and all of the things that come with that. So we're talking about the time when someone is 17 and transitioning over to 18, which in the United States is the point at which we are considered adults. Now, we've done a couple workshops in the past and I'll outline those, but today is something I've been a little bit nervous to present on because this is a bear of a topic. And that topic is the state Medicaid waivers. The reason I say this is a bear of a topic is I've only ever lived in the state of Utah my whole life, other than a couple years in Brazil. So I don't know every single state's waiver programs as well as I'd like to. However, what we can offer here is resources on how to find it. And so today, that's what we want to talk about is just what are these? How do we get more information on them? How can we take advantage of them? And then we'll kind of go from that point. So let's start with this. I've mentioned this in a couple of our workshops in the past, and I want to lead off with it. What is special needs planning? Well, I could answer that a lot of different ways. There's been a lot of different definitions that I've given in the past. Here's one that I like right now, which doesn't encompass everything, but for the purposes of our conversation today, I like. And that is special needs planning is qualifying for and taking advantage of all publicly available benefits while never being 100% dependent on them. Okay. Now, I do want to point out, I am very sensitive to the fact that some of us on the call or who will be watching this may in fact be 100% dependent on those public benefits. I sympathize, I empathize, I understand that that might be the situation that you find yourselves in. And that's why they're there, quite frankly. In fact, I'm working with a lady right now who actually moved from her home state where she had spent her entire life to another state that offered a very particular benefit as a caregiver. She would be compensated as a caregiver. Now, for this particular woman, she has a very medically complex and fragile child. And it's very possible that her child will pass away before she does. Which means that if that happens, this parent is going to lose this caregiver compensation because she will no longer have a child with special needs or disability, and she would not be able to live. She wouldn't have enough income to be able to live without this caregiver compensation. That's a very real world example of how important these public benefits are. So again, I say this with a lot of sensitivity to the fact that a lot of people do depend on these, but the reason you're here, the reason that you're on this call with us or in a part of our group is because we want to find ways to create a little bit more independence for ourselves to not be dependent on it. So that's my soapbox. I'll go ahead and get on with the presentation, but I just wanted to point that out. Here's what we've talked about so far in our little mini series of transition to adulthood. We first started with applying for supplemental security income or SSI. And our last workshop on transition to adulthood was about applying for Medicaid. If you'd like to learn more about these topics and you weren't able to make it or see the recording, go to our Facebook group. Again, we have a directory that outlines all of the workshops with links on where to find them, and you can get some good information on this. We're going to continue on today with state Medicaid waivers. So let's start with this. What's the difference between Medicaid and Medicaid waivers? Because a lot of times they can be mixed up or confused. Medicaid, if we just say Medicaid with no other context, what we are talking about in general is probably going to be the federal and state funded health insurance. Okay. These are programs that are eligible or that are available for eligible individuals who have little income and assets, and I'll talk about that a little bit later on what that looks like. Medicaid waivers are different. Yes, they fall underneath the Medicaid umbrella, but when we're talking about Medicaid waivers, this isn't necessarily health insurance. Okay, this is going to be more on the services and support, and that's what we're going to talk about today. Let's talk about what Medicaid waivers do. And this information comes from Medical News Today, which really had a phenomenal article with a ton of links, and I'm happy to point that out as well. But here are the nuggets that I wanted to pull out from it. Medicaid waivers allow individual states, okay, we've got 50 states, we have some other, I don't know if they're territories or what we call them here, but we've got 50 individual states that operate from a federal level, but each have their own decision-making on an individual level. It allows individual states to choose how healthcare professionals can provide care to a person with a disability or special needs in their own home or community instead of a long-term care facility. That's the basis of this Medicaid waiver. Instead of sticking everyone who has a need or a support in a long-term care facility, they're coming to us in our own communities, in our own homes to serve this need. These are often referred to as a home and community-based services or HCBS. You don't need to remember that. The reason I pointed out is if you see HCBS on a lot of these informations, I want you to understand what it's talking about. And these HCBS waivers, Medicaid waivers, they help with things like case management, homemaker services, home health aides, respite care, personal care, adult daycare, caregiver compensation. The list goes on. This is not an exhaustive list here, but at least a little bit of some information on what's included in these Medicaid waivers. Let's continue on with what do Medicaid waivers do. This comes from Utah Parent Centers Empowering Individuals with Disabilities. Medicaid waivers play a crucial role in providing essential support and services to individuals with disabilities or special needs, allowing them to live independently. That is the primary goal of these waivers, is to create some semblance of independence, and that looks very different for all of our children. And actively participate in their communities. These waivers are designed to bridge the gap between healthcare, so that Medicaid healthcare that I talked about at the beginning, healthcare needs of people with disabilities, and the services covered by traditional Medicaid. Okay, so prior to having these Medicaid waivers, there was that gap where we had healthcare, but we didn't have these services, and that's what these Medicaid waivers are designed to do. I want to go behind the scenes a little bit. Help us understand from the perspective of our legislators, how do these look? And this is important from an advocacy perspective. And we're going to talk about that at the end here. But let me give you an idea of what they're looking at. When I say they, I'm talking about the legislators. You also may come across this term. Again, not something you ever need to remember, but if you see it, you'll understand, okay, that's what that is. They call this the Section 1115 demonstrations. And this refers to these individual state waiver programs. This is a section of the Social Security Act, and it gives the Secretary of Health and Human Services in each and every one of the 50 states the authority to, quote, waive certain provisions of the Medicaid law to improve service programs. Hence the term waivers. That's why we call them waivers, is these are here to really, it's a pilot program. They're sort of testing these things to see if they're going to work. And therefore, they waive certain laws and rules and provisions of typical Medicaid to allow these services. So just kind of a peek behind the scenes of why we call them waivers. A little bit more additional behind the scenes, it's again important for us to understand how legislators see these waivers so we can be a better advocate. And here's how they see it. In order for a Medicaid waiver to exist, to have funding, to be encouraged to continue and provide support, it must do the each of the four following bullet here. Not cost more than the same service in a healthcare facility. So again, the Medicaid waivers, they come to us in our homes, in our communities. However, if this costs more than a facility, then they're going to get rid of it and they're going to say, we're just going to do this in a facility. It must also help protect a person's health and welfare. If they're coming to us away from facilities, it has to provide protection. It must provide reasonable and adequate standards to meet someone else's needs. And it must use an individualized plan of care centered on the person. I think this is the hardest one, because if they're creating this on a state level, but it has to be individualized, that requires a lot of resources to make happen. And that can be, again, costly. Going back to that first point, this service can't cost more than it would in a facility. Otherwise, it's not going to be approved and therefore funded. So let's talk about how to qualify for these Medicaid waivers. The first thing that I'll say, and I can end the presentation right here, this is the hardest part. Every single state and each waiver has its own eligibility requirements, right? Not only each state, but literally every single waiver is going to have different rules. And that's why it can be so difficult to fully understand what each of these waivers provides. That said, let's talk about how, in general, if we want to be able to qualify for as many Medicaid waivers as we possibly can without having to understand each and every requirement, what can we do? Well, if we qualify for Medicaid, the healthcare, it's often going to be the first step because that will probably qualify us for the state Medicaid waivers. So here's how you qualify for Medicaid, the healthcare. In 41 of the 50 states here in the US, they use supplemental security or SSI's eligibility requirements. So if you're following the chain here, in order to qualify for the state waiver, you have to qualify for Medicaid. In order to qualify for Medicaid, you have to qualify for SSI. SSI is our key here for the majority of our states. Here's SSI's eligibility criteria to make all the rest of this work. You must either be 65 or older, blind, or have a disability. For the purposes of most of us here today, we're talking about the disability. There's specific ways to outline what that disability is and how it's deemed an official criterion. You can see that on what's called the Blue Book on Social Security. Again, if you go back and watch our previous workshops, it will outline all of those that are already approved. On top of being disabled, you must pass what's called a means-based test, which has an income and an asset limit. The income, this gets a little fuzzy and it can vary state to state as well. We're going to say if you make more than $1,971, which is a very specific number, if you make more than that per month, you will not qualify for SSI. You may have SSI, but they're not going to pay you anything. The second part of this, though, would be the asset test. And the asset test says that as an individual, an unmarried individual, you cannot have more than $2,000 of resources in your name. This would exclude a primary home, a primary vehicle, and if you're living in your parents' home, as an example, and they're providing groceries or food or things like that, we can charge a room and board to help us get around it. In general, if we pass these criteria, you will qualify for a Medicaid state waiver the majority of the time, okay? Now, for the other 9 states and territories or whatever we call them that don't follow these rules, again, in our previous workshop, the transition to adulthood on how to apply for Medicaid, I've outlined the rules on exactly how those work in those other states. But in general, if you follow this, you're probably going to qualify for the waiver programs. Okay, let's understand what's available. This is going to be the biggest part probably of our conversation today. This is going to be really important for you to help understand how to find this. Here's what we're going to do, and I'm going to do this with you on screen so you can see what it looks like. We're going to go to Medicaid.com, okay? And I'll just type this in with you, Medicaid, or excuse me, not .com, .gov, Medicaid.gov. We're then going to click right in the middle here where it says Medicaid. We are then going to go to this section 1115 demonstrations, okay? As I mentioned, that's what they call these state waivers. We'll click on that, and then right here on the left, you'll see state waivers list. If you click on this state waivers list, it is going to pull up 626 different waivers that exist throughout the United States. Now, obviously, this is only going to be applicable based on the state in which you live. So please go to the state on the left or on the right here. You can filter by state. I'm going to go ahead and click on Utah because that's where I live. And this pulls up a list of 15 different waivers that are applicable in the state of Utah. And I can go through and click on them. A common one here in the state of Utah is the Utah Community Supports Waiver for individuals with intellectual disabilities and other related conditions. I can click on this, it'll give me a little bit of some information, and then I can click on the waiver description, and it will outline exactly what this waiver does. So this is a really good starting point for us to be able to see, great, do I need this? Do I want this? Does this appeal? Would this benefit my family, etc.? Okay, now where this falls short is this website isn't going to tell you all of the eligibility criterion. And we're going to get there on how you can find that. But hopefully this will at least help you understand what's available to you, and then we can get back to it. Now, Robert pointed out something here in the chat, and I'm going to talk about this here in just a minute, but he's exactly right. A lot of these Medicaid waivers, especially for minors, they totally do not look at mom and dad's income or assets, which is really, really helpful, right? Again, for today, we're more focusing on probably that transition to adulthood. So we're now adults and it probably won't matter a whole lot anyway. But yeah, there are a lot of waiver programs that, you know, for example, we have one that we're in the process of applying for my daughter. My daughter's 5, and it's the Medically Complex Children's Waiver. Well, it doesn't look at my income or assets as her parent, which is really nice. So that's just a really good example. Thank you for pointing that out there, Robert. Okay, so go to this website, like I said, really good starting point just to see what's out there and available to you. I want to go through a couple tips as we wrap up here. Many states have a higher demand for services than they do funding, right? Most states, I would say, unfortunately, this would be the case. This then creates a very extensive wait list. which can be very frustrating. We're talking sometimes 10 plus years. Okay. Here's and this is going to be our call to action here at the end, but I'm going to point it out again right now. Please, please, please get on your state's Medicaid waiver waitlist as soon as you possibly can. If it's a general services waitlist, get on it. If it's a specific one, get on it. Even if you don't immediately need services, please get on the waitlist. And here's why. It tells our legislators that there is a need. Again, we're going to talk about some advocacy as we wrap up, but they don't oftentimes get it, right? But if they start to see this wait list get longer and longer and longer, it tells them that, hey, it looks like there's a need. We don't have enough funding here. Let's see if we can figure something out here. Another tip. Some families have significant or sufficient private resources. When I say private resources, I'm talking about assets, income, just money, right? For simple terms here. And they don't feel it's necessary to go through the hassle of applying for public benefits, such as a state Medicaid waiver, when they can simply pay for it out of their own pocket, or private pay, as they would call it. That is totally true. And some families do have that circumstance. What I would say is please consider the following. Some services will not accept your money even if you're Elon Musk, right? If you say, I'll take you on a trip to Mars, I'll give you $1 billion, whatever, 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 they cannot accept private pay, and it has to go through Medicaid. And so, sure, yeah, there's a lot of really good programs out there, respite care, adult care, those types of things. Again, they may not accept your money. It might have to go through Medicaid, and that would be a reason to consider, even if you have sufficient assets to provide for the care of your loved one with special needs or disability. Next tip, not to get political, especially as we're approaching an election year. This is taboo. You're definitely not supposed to do this, but I'm going to do it. Blue or more liberal or Democrat states often have more favorable state Medicaid waivers, whether it's the services are better, the resources are better, the wait lists are shorter, there's more funding. Any and all of the above a lot of times do apply to those traditional blue states. Conversely, typical red states, Republican conservative states, oftentimes have less favorable resources, Medicaid waivers, etc. And that goes back to the example that I mentioned earlier of the lady that I was working with, who was from the state of Utah, which is a traditionally red state, and she moved intentionally to a more neutral state. It wasn't even necessarily blue per se, but a more neutral state because it had better resources. If you have the ability and flexibility to move to a different state and you're heavily dependent on these resources, this is a really good starting point for you to consider some of those blue states that may be more friendly. I know Washington is one of the top in the country as an example of benefits provided. Medi-Cal as well, for all of the challenges that California has. Medi-Cal is a very robust program. So just some things to consider when it comes to taking advantage of these benefits. Some other tips, some waivers are available to minors, just as Robert said earlier, meaning under the age of 18, and they don't rely on the parent or guardian's means-based test, which is their income or assets. So that's certainly something to consider. You may, though, have to reapply for waivers or get back into the system, depending on your state, once they turn 18. So don't assume that just because they were on a waiver at some point as a minor, that they have to, or that they're automatically going to qualify for all of these benefits in the future. May have to reapply. There are also no hidden or secret public benefits, okay? I've sometimes seen things where people will say, hey, come and learn about this super secret benefit or this hidden tip or trick. They're just not out there. And maybe they're referring to the fact that these can be really difficult to understand. And so maybe that's the secret. But there's no magic resource out there that just, only certain people have and everyone else is missing out on. The way that I like to think about it is these public benefits are really made available to all eligible citizens, and they really should be treated with respect, right? I won't say this is a right because it's not, but this is one of those basic things that we've been afforded as as citizens of this country. And so they should be treated with respect and not, sent out to say, hey, this is a super secret thing, or let me tell you about this crazy benefit that no one else knows about. We want to make sure that everyone has access to these resources if they qualify. Here is a resource that I want to share, not very specific, but maybe more generalized. Most states have a nonprofit or multiple nonprofits, depending on how large the state is, that will help you understand, select, apply, and receive all of these state waiver and services that we talked about absolutely free. Okay. If you don't know where to turn, if you're not sure where to find that organization, please reach out to me. I'm happy to help you find most of the states that touch or surround Utah. I know of those different organizations that help, and they do a phenomenal job. If, however, again, you don't know, I'm happy to help you find them. They're probably there in plain sight, just waiting and wanting to help. That's why they exist, is to be able to help our families understand and apply for these benefits. They'll walk you through it as much as they possibly can. So please take advantage of that. And here's where we're going to end on an advocacy level. And the reason I end with this, if you have any extra energy at all, we know that being a parent in general, much less a parent of a child with special needs, on top of a career or any other things that we have going on, it can be draining. If you have any extra energy at all, please consider advocating for additional funding and resources, which are going to bless the families after you. Okay, and that's why we do this. That's why the special needs community is such a special place, is we are here obviously for ourselves, but also to help others. Share your family story on Capitol Hill. There's so many, again, nonprofits and organizations that go to the state capitol multiple times a year to share their stories with our legislators and our political leaders. A lot of times they just don't get it. And it's not necessarily their fault, right? If they're not personally affected by a disability or someone with special needs, they probably won't get it. I know that we've had a battle here in Utah. Again, Utah is not known for its wonderful benefit programs. And so we have incredible individuals and organizations who are really spearheading the advocacy efforts here in Utah. But they go up to Capitol Hill all the time and talk with our legislators and help them understand the need that they have. Because a lot of times from their perspective, they're looking at it as a mathematical equation, right? I can either give money to this disability benefits program that will, certainly help families, or I can invest it into infrastructure, which will better our economy. And if we have a better economy, then we're going to have more money anyway. And so that's the way that they're thinking about this. Again, it's not necessarily their fault, but if we can help them understand how important these benefits are to our families, it's a huge win for all individuals involved. Here's my call to action for you, as I mentioned at the start of the workshop. Please go to that website that I mentioned, the Medicaid website that outlines all of the waivers, and start to get familiar, read that quick little paragraph on what they do, and understand if this is something that would bless your family. And if it is, apply for it. Get on the wait list. Don't do this alone. Please work with a nonprofit that's local to you that will allow you, that will provide resources to be able to help you understand and apply for all of these different resources that are available. And then again, finally, as our last call to action, get on the wait list as soon as you possibly can. It can be very long. I think, Robert, you mentioned on Eastern states, it's like 100 years. That's not good, right? I don't live on the Eastern states, but I know that in Utah, it's presumed at least 10 years, right? And I know that we are getting additional funding, and so the wait list is going down a little bit, but it's a hard deal. You also pointed something out, Robert, about tax dollars. I didn't put this in the presentation, but I am going to throw it out. A lot of states have different programs on. You can actually choose to send, if your state has income tax, for example, which Utah does, you can actually choose to send your state income tax to some nonprofits that support disabilities. And so to your point on what our taxes are going towards, we can't control them entirely, but we can certainly send them in ways that may be more beneficial to the families after us. Okay, that does it for today's workshop on transition to adulthood, state Medicaid waivers. Here's what's coming next in our mini series: transition to adulthood, guardianship, and other supported decision-making options. We're actually going to invite an attorney here in Utah who specializes in guardianship and supported decision-making to join us and teach us and talk to us about all of the options that we might consider. Guardianship is not the only option. There are many other out there. But also we'll talk about the timing on if that is the step that you choose to take, when should you do it, as we're in this transition phase from 17 to 18. Here's my information I'll throw up on here. If any of you have questions about anything we talked about today or anything else related to special needs planning, I don't profess to know everything, but I know a lot of people who know a lot of things. And so I'm happy to connect you with the people that are experts in areas where I just don't have the information or education. But you can scan the QR code. It'll take you, I believe, directly to just a general link with a bunch of information. You can see my website and email and phone number there. Again, I'm in Utah, so if anyone wants to meet in person, which no one does, and that's okay with me, you're welcome to come by my office in Provo. Otherwise, if you have an internet connection, we can reach out. So I'll end here with, typically we do some Q&A, but I don't think the majority of our individuals here in our Zoom meeting will have some questions, but I'll certainly turn it over to them. We'll keep the live stream going on our social media platforms. And again, thank you for everyone who joined us. If you have any ideas of other workshops that you'd like to hear about, please let us know in our Facebook group, and we will certainly include those. All right. I will turn it over to Q&A if we have any for those of you who are in our Zoom meeting. Otherwise, we will end the meeting and continue on with our day. All right, going once, going twice. And Deborah, I saw you join just a little bit late here. We try to do these pretty quick, so you can catch the recording in our Facebook group of everything that we talked about. So, all right, everyone, thank you so much. We will see you here at the end of the month on our next Tuesday workshop. Have a good one.